Assalamu alaikum. Today I am going to talk about Cauda equina syndrome. Cauda equina syndrome is a rare but serious condition where the neural roots at the end of the spinal cord are compressed. Cause of Cauda equina syndrome: herniated disc, spinal tumors, spinal stenosis, trauma or injury, infection and abscesses, lumbar disc prolapse, spinal hematoma, inflammatory conditions, post-operative complication. Symptoms of Cauda equina syndrome: low back pain, leg weakness, saddle anesthesia, leg pain, sciatica, numbness or weakness, bladder dysfunction, bowel dysfunction, sexual dysfunction, loss of reflexes. Diagnosis of Cauda equina syndrome: physical examination, clinical assessment, neurological examination, and evaluation of symptoms such as bowel bladder dysfunction are vital for diagnosis. A thorough neurological examination is essential to assess motor and sensory dysfunction, reflexes, and other neurological signs. MRI, magnetic resonance imaging. An MRI scan of the spine is often used to visualize the spinal cord and nerve root. It can help identify the cause of compression and the extent of damage. CT scan. CT is computed tomography, myelogram. This test involves injection a contrast dye into the spinal canal to enhance imaging during a CT scan. It provides detailed images of the spinal cord and nerve root. Urodynamic studies. These tests evaluate bladder function and can help determine the extent of neurological involvement. Blood tests may be conducted to rule out the other potential cause of symptoms. Treatment of Cauda equina syndrome: medication and cryotherapy or physiotherapy. Cryotherapy is cold therapy. Cold therapy can help alleviate pain by reducing nerve condition and slowing down the transmission of pain signal. It may be particularly useful for managing acute pain or inflammation. It may also help in reducing muscle spasm, which can be common in condition involving nerve compression by numbness the affecting area. It can contribute to muscle relaxation. Thermotherapy is heat therapy. Heat therapy can help relax muscle and improve flexibility. This can be particularly useful for individuals with Cauda equina syndrome who may experience muscle tightness or spasm. Heat promotes vasodilation, leading to increased blood flow to the targeted area. Improved blood circulation can aid in the delivery of oxygen and nutrient to tissues, supporting the healing process. Heat therapy can be effective in healing chronic pain, stiffness, and discomfort. Applying heat before stretching or range of motion exercise can enhance the effectiveness of the activities. It can make tissue more malleable and reduce the risk of injury during exercises. And transcutaneous electronic therapy, that is the TENS, involve the use of a small battery operated device that delivers low voltage electric stimulation to the skin. It may help in managing pain by interfering with the transmission of pain signals. Neuroelectric stimulation. Neuroelectric stimulation is used to stimulate muscle contractions by delivering electric impulse to nerves. It can be employed to prevent muscle atrophy and improve muscle strength in individuals with weakness and paralysis. Electric stimulation for pelvic floor muscle. It may effective pelvic floor function, leading to bladder and bowel dysfunction. Electric stimulation can be used to target and strengthen pelvic floor muscles, helping in the management of incontinence. And range of motion exercises, controlled and progressive range of motion exercises help maintain joint flexibility and prevent stiffness. These exercises are tailored to the individual conditions and may include movement of the spine and extremities. Strengthening exercises, targeted exercises aim to strengthen muscle weakened due to the nerve compression. The focus may be on the muscle of the lower back, hips and legs. The intensity and type of exercise will depend on the individual specific condition and functional goal. Balance coordination training. Cauda equina syndrome can affect balance and coordination, especially if there is a weakness or paralysis in the lower extremities. Physiotherapists work on exercises that enhance balance and coordination to improve mobility and reduce the risk of falls. Then last is pelvic floor rehabilitation. Cauda equina syndrome can lead to bladder and bowel dysfunction. Pelvic floor exercises and biofeedback may be employed to address incontinence issues and improve pelvic floor muscle function.